Hello, my name is Dr. Diwan S. Raja. Today I will describe about the anatomy of the popliteal fossa. The popliteal fossa is a diamond-shaped depression at the back of the knee. It includes lower part of the back of the thigh and upper part of the tibia. So this is the popliteal fossa. Popliteal fossa is a diamond shape depression on the back of the knee and the lower part of the back of the femur. Okay, knee and the lower part of the femur and the upper part of the back of the tibia. So we got the definition of the popliteal fossa. This is a diamond-shaped depression on the back of the knee and the lower part of the back of the femur. There is the popliteal surface of the femur and the upper part of the back of the tibia. So this is a diamond-shaped space. Suppose we draw a diamond like that way, diamond-shaped space. Okay. So we'll go through the boundary and contents of the popliteal fossa. Boundaries and contents. Boundaries. Okay. Above and laterally. Above and laterally. Laterally is bounded by the biceps femoris muscle. Okay. Above and laterally is bounded by biceps femoris muscle. Okay. Above and medially. Okay, is bounded by the semimembranosus muscle and semitendinosus muscle, Okay, so it is bounded above and medially. This is above and medially. Okay, this is bounded by the semimembranosus and semitendinosus muscle. Semimembranosus, membranosus, and semitendinosus. Semitendinosus muscle. The semimembranosus is anteriorly, it is covered. The semitendinosus passes over the semimembranosus. Its name is semimembranosus because its origin is membranous origin. Its name is semitendinosus. Its insertion is tendinous. Okay, we got above and medially, above and laterally. Okay, above and medially we got the semimembranosus, semitendinosus, supplemented by above and medially, supplemented by gracilis, sartorius muscle, gracilis muscle, and adductor magnus. Okay, we got the boundary semimembranosus, over semimembranosus with the semitendinosus. This is superficial to this. This is over semimembranosus, and this part is supplemented by gracilis, sartorius, and adductor magnus. Okay, we got above and laterally. We got above and medial. Now we'll go to the below and laterally. Below and laterally. Laterally. Here, this is below and laterally. And laterally, it is by means of the lateral head of gastrocnemius, lateral head of gastrocnemius muscle, supplemented by the plantaris muscle. So, lateral head of gastrocnemius, okay, gastrocnemius, and supplemented by plantaris muscle. Okay, we got the below and lateral boundary. How about below and medial boundary? Below and medially. This is below and medial, and this is below and medial, below and medially. This is bounded by the medial head of gastrocnemius. Okay, it is bounded by the medial head of gastrocnemius. Medial head of gastrocnemius. Okay, we got the boundaries of the popliteal fossa. It is present behind the knee joint, including the popliteal surface of the femur and upper part of the back of the tibia. Okay, we got the boundary. Now we go to the floor of the floor. How the floor of this diamond shaped space is formed. Floor of the popliteal fossa. Okay, from above downward, from above downwards, we have the popliteal surface of the femur. Popliteal surface of the femur. That is the lower 1/3 of the back of the femur. The popliteal surface of the femur, then we'll get the capsule of the knee joint. Of the knee joint. We get the oblique popliteal ligament. Oblique popliteal ligament. Okay. Oblique popliteal ligament. Then fascia covering the popliteus muscle. Popliteus muscle. So we got the floor of the popliteal fossa. Floor of the popliteal fossa. Above it is bounded by here the femur here. Here is the joint, the knee joint. Here the upper part of the back of the tibia, and we have the muscle here, the lateral head of gastrocnemius, that is supplemented by the plantaris muscle here, with another muscle, that is this muscle is the plantaris. Okay, and we'll get a fascia covering the plantaris muscle. Okay, fascia covering the plantaris muscle. That fascia comes out from the insertion, membranous insertion of the semimembranosus that cover the plantaris muscle. Okay, and we'll get the oblique popliteal ligament here. Oblique popliteal ligament. We get oblique popliteal ligament. Okay, so we got the popliteal surface of the femur, the joint, fibrous capsule of the knee joint, oblique popliteal ligament, fascia covering the plantaris muscle. This forms the floor of the popliteal fossa. Okay, now we'll go to the contents of the popliteal fossa. Contents. Okay, contents of the popliteal fossa. Again, if we draw the diamond shaped space, this is a diamond at the back of the knee joint. What are the contents? Contents of the popliteal fossa. Popliteal fossa. Okay, its name is popliteal, so it contains popliteal artery, popliteal vein. So popliteal artery and its branches Okay, so popliteal artery and its branches, then popliteal vein and its tributaries Then we'll get the tibial nerve and its branches. Okay, we'll get the common fibular nerve and its branches. Okay, so we got, these are the major contents. We have to describe the roof of the popliteal fossa. Popliteal fossa has floor, roof. How it is formed? Roof is formed by the popliteal fascia. Popliteal fascia. Okay, covered by superficial fascia and skin. Covered by superficial fascia or fascia and the skin. Okay, so that is the roof. So we have some content in the roof, the cutaneous structure. So we have popliteal artery and its branches, popliteal vein and its tributaries, tibial nerve and its branches, common fibular nerve and its branches. We have some other cutaneous branches like the, so you can write here, cutaneous structures. Cutaneous structures include the posterior division of the medial cutaneous nerve of the thigh, posterior division of the medial cutaneous nerve of the thigh. Okay, we got one. We have the sural, we have the sural communicating nerve, sural communicating nerve. We have posterior cutaneous nerve of the thigh, posterior cutaneous nerve of the thigh, also called posterior femoral cutaneous nerve, posterior cutaneous nerve of the thigh. So these are also content. And we have the lateral cutaneous nerve of the cuff, lateral cutaneous nerve of the cuff. Okay, these are the cutaneous structure. Okay, so posterior division of the medial cutaneous nerve of the thigh. Okay, so if you again draw a diamond shaped structure here, okay, we'll get here the posterior division of the, this is number 1, then we'll get the sural communicating nerve, okay, that is coming from the common fibular nerve, okay, sural communicating nerve. Here we have the sural nerve, we have the posterior femoral cutaneous nerve. Okay, so these are the structure, and we have also the lateral cutaneous nerve of the cuff here. So this is the 1, sural communicating nerve number 2 here. Number 3 is the posterior cutaneous nerve of the thigh. Okay, posterior cutaneous nerve of the thigh. Then we have the lateral cutaneous nerve of the cuff. Okay, we have also add as our content the sural nerve and the termination of the small saphenous vein. So we may add those as a content. Okay, additional content we may add, those are the contents. You can add the content as terminations of the contents. Okay, termination of the you can say the small saphenous vein, small saphenous vein opening into the popliteal vein, opening into the popliteal vein, that is a content. Okay, the termination here. And also we have the sural nerve. Sural nerve, there is a content. Sural nerve is a branch of the tibial nerve. So again, we'll summarize the content. Popliteal vein and its tributaries, popliteal artery and its branches, tibial nerve and its branches, common fibular nerve and its branches. Okay, and small saphenous vein, part of the small saphenous vein opening into the popliteal vein. Sural nerve is a branch of the tibial nerve. We have cutaneous structure. Sural nerve is also a cutaneous structure. Okay, small saphenous vein is also cutaneous. Okay, the posterior division we can add as 5, 6. Okay, posterior division of the medial cutaneous nerve of the thigh. Sural communicating nerve, this is a branch of common fibular nerve or common peroneal nerve. Posterior cutaneous nerve of the thigh, lateral cutaneous nerve of the thigh. We will add few more content. Those are always present. These are the lymph nodes. Lymph nodes. We add other content. These are the major contents. These are the major content. These are the other contents. Okay, so we have to add fat, plenty of fat. So these are the major contents. Okay, these are the cutaneous structure. Those are the content in the roof of the popliteal fossa. These are additional content. They are also cutaneous. Okay, and these lymph nodes are present on the floor in the deep under the skin. Okay, also a lot of fat on the floor. Okay, we got the contents of the popliteal fossa. Okay, now we learn how the popliteal artery, popliteal vein enters the popliteal fossa. Okay, so the popliteal artery is a branch of femoral artery. Okay, and the popliteal vein is a tributary of the femoral vein. Okay. We got that. They reach the popliteal fossa through the this artery. Okay, is a branch of femoral artery. It passes through the adductor hiatus. That is a gap in the adductor magnus, in the adductor magnus, Okay, so the femoral artery is a popliteal artery is a branch of femoral artery. It enters the popliteal fossa through the adductor hiatus. Likewise, the popliteal vein is a tributary femoral vein. It enters the adductor canal through the adductor hiatus. So, adductor hiatus is a passage for the popliteal artery to go down to the popliteal fossa, and adductor hiatus is a passage for the popliteal vein to go up to the adductor canal. So this is going to the femoral vein. This is a branch of femoral artery, so they use the adductor hiatus. This is the gap in the adductor magnus. The adductor hiatus also contain a branch posterior division of the obturator nerve. So obturator nerve posterior division we may include as a content of the popliteal fossa. So what are the contents of adductor hiatus? Adductor hiatus, what does it transmits? So you can write it here. Structures transmitted by the adductor hiatus. Adductor hiatus is a gap in the lower part of the adductor magnus. A gap in the lower part of adductor magnus. Okay, we got that. Structures transmitted by the adductor hiatus. We have the popliteal artery. It descends to the popliteal fossa. Popliteal vein that ascends to the subsartorial canal or adductor canal, and posterior division of the obturator nerve supplying or innervating, supplying the knee joint, the fibrous capsule area, knee joint capsule. Okay, we got the contents of adductor hiatus because these are related to the popliteal vein, popliteal artery. Okay, we got the contents adductor hiatus. We should add the obturator nerve as a content of the popliteal fossa. The posterior division of the posterior division of the obturator nerve as a content of the popliteal fossa. So we now learn some clinical anatomy. Okay. The popliteal fossa, there may be cyst formation. We call it popliteal cyst, also called Baker's cyst. These are the protrusion of the gastrocnemius or soleus bursa. Protrusion of gastrocnemius or soleus bursa to the popliteal fossa. or it may be just a herniation of the synovial cavity of the knee joint to the popliteal region is one way, or just protrusion of the synovial membrane and fluid into the popliteal fossa. Okay, this may extend to the mid calf area to go down. Okay, and it may restrict the movement of the leg, especially in the elderly. In children, it may not cause much problem. Okay, is one popliteal cyst or Baker cyst. We have one more clinical anatomy. Okay, that is, this is the site. The orbital fossa is the site. This is the site to assess blood pressure in the leg. Okay, it is important to compare the popliteal blood pressure to that of the brachial plex blood pressure. To compare the popliteal blood pressure to the brachial blood pressure. So, if we can say brachial artery blood pressure. This is found there will be high blood pressure in the brachial artery, low